Good evening. My name is Nand Kejriwal. I'm a cardiothoracic surgeon in Waikato Hospital and Southern Cross Hospital in Hamiton in New Zealand. I was trained in India in the prestigious Christian Medical College, Vellore. I spent 8 years in Australia and 1 year in England, and now for last 19 years I'm working here in this great country, New Zealand, or also called Aotearoa. I will talk to you today about CPR. CPR is cardiopulmonary resuscitation, that is to revive the heart and the lung. New Zealand has a population of only 5 million people, but you may be surprised to know 2,000 people are treated for cardiac arrest every year, and that is in the community, not in the hospital. And unfortunately, only 1 in 10 survives. And in the current era of COVID, if somebody already has a health problem like heart or lung, and if he gets a COVID, a higher risk of cardiac arrest. So the formula is DRS ABCD. Those who are interested in cricket, they could have heard DRS, decision review system, just to remember. So D stands for danger, R for response, S shout for help, A airway, B for breathing, C for CPR, that is chest compression and breathing, and D for defibrillator. That is the whole process. Ambulance takes about 6 to 8 minutes to reach on the scene. And it has been shown that every minute without CPR will decrease the chance of survival by 10 to 15%. Therefore, if somebody has a cardiac arrest, the only chance of survival is if somebody next to him, a bystander, initiates CPR as soon as possible and gives a shock to the heart if the machine is available. It is called AED. You must have seen the signs near shopping center, etc. The automated external defibrillator. And cardiac arrest happens most commonly at home, but it can happen on the road, in shopping mall, or anywhere. So let us find out which person will need a CPR. The formula is DRS ABCD. D for danger. If somebody has collapsed, first make sure there is no danger around. For example, heavy traffic or fire, you may have to move the person to a safer place. Then R, check the response. Hello, how are you? If there is no response, tap on the shoulder. Hello, open your eyes. Still no response. S, shout for help. Help, anybody there? If somebody comes, please ring 111. Tell them there is a cardiac arrest and call for ambulance. And can you please find out if there is a defibrillator around? Now A for airway. Open the airway. One hand on the head to tilt the head, one on the chin. That will open the airway. Now B for breathing. Check for breathing. Bring your ear next to the nose and watch for the movement of the chest and listen and feel for the air coming out of the nose. If there is no breathing and no response, start CPR immediately. Don't waste time in checking for the pulse. C for CPR, that means chest compression and breathing. To give an effective chest compression, use the heel of the hand on the center of the chest, bring the other hand on the top, make sure your hands are straight, your shoulder should be above your hand. That way you can really apply pressure, because the chest must move at least 5 centimeters in an adult to be effective. When you compress the chest, blood will go to the vital organs in the body like brain, so it will keep the brain alive till the ambulance comes in. When you release, blood will come back to the heart. You should do it 100 to 120 times a minute. So keep counting 1, 2, 3, 4, 5, 6 and go up to 30. Once you have done 30, give 2 breaths. 30 to 2, no matter who, every age. For breathing, maintain the chin lift. Pinch the nose, otherwise air will escape. Take a breath. Make sure chest moves. Do one more. If there is another person around, one will be doing compression, one will be doing the breathing, because the person doing compression will get tired, then you swap. Then if defibrillator is available, please use it even if you didn't have a training. It is very simple to use. Switch the machine on, it will tell you where to put the pads. It will check the ECG, it will tell you where shock is required. If shock is required, a button will flash. And all you have to do is press the button, but make sure nobody is touching the patient. Shock is given, now continue CPR. After 2 minutes, machine will tell you again to stop. It will check whether shock is required. If the machine is available to give a shock, please use it. It is called AED, Automated External Defibrillator. It had been shown that if a shock is given before the ambulance arrives, the chance of survival increases from 10% to as much as 40%. It's very simple to use. You switch the machine on, machine will talk to you, it will tell you where to put the pads, it will check the ECG, it will tell you whether shock is required. If yes, a button will flash. Before pressing the button, make sure nobody is touching, shock will be given, continue chest compression and breathing. After 2 minutes, machine will ask you to stop. It will check again. If shock is required, it will be given. And continue this cycle till either the patient starts breathing or ambulance arrives and they will take over. If you do this whole process, one day you may be able to save a life. Thank you very much for watching.